Hi, I'm Lorna. I'm one of the speech and language therapists at Queen Square, and I specialise in functional neurological disorder. People can experience a wide range of changes to their speech or voice with functional neurological disorder. Some examples include difficulty saying speech sounds or slurred sounding speech, changes to voice quality, or stammering. Sometimes these symptoms are present all the time, and sometimes they come and go. It is helpful to keep a brief journal of symptoms for your therapist. Try phrasing your journal like this: when I feel tired, my communication symptoms are, or my speech is at its best when I feel. Also, you can take note of the following: if and when the symptoms are better or worse. For example, are there different times of day or certain places or conversations with certain people when you notice the symptoms are different? Describe your symptoms to help you tune into them. For example, my speech sounds were not clear, my voice was very quiet, or talking felt physically challenging for me. Scoring your symptoms can also be helpful to tune into variability. For example, if your communication was scored 10 out of 10 with no symptoms, then you might score it out of 10 accordingly when you experience symptoms. For example, some people might say, in the morning, my symptoms are 9 out of 10, so quite close to not having symptoms. And at other times, they notice they might score them 5 out of 10. Other things you can do in your journal are to reflect on how certain conversations make you feel. Some people may notice they feel calm and happy talking to a certain family member, for example, or frustrated and upset when talking on the phone to someone unfamiliar. However this looks for you, it's useful to try to tune into it. Are there certain topics of conversation where you notice your symptoms are more noticeable? Some general tips on managing your symptoms. Like other physical symptoms, speech or swallowing can be impacted on or triggered by heightened emotion, such as anxiety or stress, or even feeling tired. Some general strategies to manage these might be: rest when your symptoms are very hard to control. This will help your brain to not use the pathways or roads that drive your symptoms. Engage in mindfulness and relaxation exercises if these are useful for you. These can help manage feelings and emotions which are linked to speech and swallowing changes in FND. Being in a more relaxed and a calmer place can allow opportunities to produce speech and swallowing patterns that you're aiming for. When symptoms are difficult, you can also try grounding practices. Sit comfortably, scan your environment from left to right, pick a colour and see how many objects in that particular colour you can see, or alternate tapping your feet on the ground while sitting, similar to marching on the spot. Visualisation tasks may also be helpful for some people. For example, imagining yourself saying things in the voice you want, or swallowing food and drink safely and clearly with no obstructions.